Hello to everyone joining us. We're just giving it a few seconds for everyone to log in, connect to audio. Again, if you're just joining us, just waiting for everyone to log in and connect to audio. I see the numbers ticking up, but we'll start in 1 minute. Okay. Hello, everyone, and welcome. Thank you for joining us for today's webinar, the Environmental Justice Index, Ranking Cumulative Health Impacts. The Environmental Justice Index is the first national place-based tool designed to measure the cumulative impacts of environmental burden through the lens of human health and human equity. Our speakers today from the Centers for Disease Control and Prevention, Agency for Toxic Substances and Disease Registry, will discuss the development of this tool, and a demonstration will be provided. My name is Victoria Bortfeld, and I am the Program Manager of Environmental Health here at APHA. I identify as a white woman using the pronouns she, her, and was raised in the dominant culture. I will be your moderator for today's webinar, and I would like to review a few housekeeping items before we dive in. Firstly, note that the webinar is being recorded, and this recorded video and the presentation slides will be shared with all those who register. For today's webinar, video, microphones, and chat are disabled for attendees, but there will be a formalized 15 to 20-minute Q&A session at the end of this webinar. So to submit a question for that session, you can find the Q&A area located at the bottom of your screen. We will be monitoring this and we'll try to get to as many questions as we can during the Q&A session. Closed captioning services are also provided. Please access these at the bottom of your screen. And lastly, there will be a survey at the end of this webinar that we would appreciate you completing. And now I will introduce our speakers for today. Dr. Sharonda Buchanan is the Director of CDC's National Center for Environmental Health, Agency for Toxic Substances and Disease Registry, or ATSDR, in the Office of Priority Projects, Innovation, and Environmental Justice. Here, she provides leadership and management of large-scale priority environmental health initiatives, promotes innovation and big idea projects and prototypes, and coordinates environmental justice work. She has also recently been named as Interim Director of the Department of Health and Human Services Office of Environmental Justice within the Office of Climate Change and Health Equity. And we also have Ben McKenzie, who is a geospatial epidemiologist and project coordinator with ATSDR's Geospatial Research, Analysis, and Services Program, with a portfolio focusing on environmental health, environmental justice, and health equity. Since 2021, Ben has served as the team lead for the CDC ATSDR Environmental Justice Index project in collaboration with the National Environmental Public Health Tracking Program and the NCEH Office of Priority Projects, Innovation, and Environmental Justice, and the HHS Office of Climate Change and Health Equity. And I will hand it off then to our speakers today. So Dr. Buchanan will introduce the development of the tool, and then Ben will provide a demonstration of the tool for us.
Well, thank you, everyone, and welcome to our Environmental Justice Index webinar. For those of you out there, I'm Sharonda Buchanan, as mentioned by Victoria, African-American, pronouns she and her as well. I'd like to set the stage by providing 3 presentation objectives. Our objectives today are threefold. First of all, I'd like to bring attention to the intersection of health equity and environmental justice. Secondly, I'd like to highlight social and physical factors that serve as underlying determinants of health. And then lastly, demonstrate the utility of the Environmental Justice Index as it addresses determinants of health in pursuit of environmental justice and health equity. I'd like for us all to be on the same page as we start this conversation. I'd like to start with the terminology health equity. And what does that mean to us here as we embark upon this endeavor? Health equity, striving for the highest possible standard of health for all people and giving special attention to the needs of those at greatest risk of poor health based on social conditions. Health disparities, differences in health outcomes and their determinants among segments of the population as defined by social, demographic, environmental, or geographic category. Social determinants of health, conditions in the places where people live, learn, work, play, pray, that affect a wide range of health and quality of life risk and outcomes. And last but not least, environmental justice, advancing health equity and eliminating environmental health disparities through the fair treatment and meaningful involvement of all people in environmental health policies, research, programs, and ensuring equal access to a healthy environment. So, why are we even here? Why are we discussing this issue of environmental justice? The rationale for this is that people of color, disadvantaged, vulnerable, low-income, marginalized, and indigenous people are disproportionately burdened by environmental hazards. These populations and communities are exposed to environmental threats that drive health disparities, they're underserved, and they're surrounded by social inequities. The combination of environmental risk and the social inequities create a cumulative, disproportionate impact that hinders optimal health and environmental justice for these populations. I always like to say that environmental justice and health equity are inextricably linked. If you find an environmental injustice, you're likely to find an environmental health disparity or health disparity. It all boils down to health. Next slide, please. So let me just take you back just a few years, almost 30 years to date, well, 27 exactly, with Executive Order 12898 that directed federal agencies to make achieving environmental justice part of its mission by identifying and addressing as appropriate, disproportionately high and adverse human health or environmental effects on its programs, policies, and activities in minority, low-income, and indigenous populations. An executive order released in 1994. The challenge is that environmental health disparities, some intransigent, persist more than 25 years after Executive Order 12898. Now, let's fast forward this to 2021, 2022. Executive Order 14008, tackling the climate crisis at home and abroad, which actually was the impetus for developing the HHS Office of Environmental Justice, as well as Executive 13985, advancing racial equity and support for underserved communities through the federal government. And last but not least, the Executive Order on Diversity, Equity, Inclusion, and Accessibility in the Federal Workforce. All of these taken together really provide a real fertile ground for us advancing health equity and pursuing environmental justice. Next slide, please. I want to focus in on the social determinants of health. And when I say social determinants of health, I'm thinking and including environmental health factors as well. Healthy People 2030 uses a place-based framework that outlines 5 key areas of social determinants of health: healthcare access and quality, neighborhood and built environment, social and community context, economic stability, as well as education access and quality. Those taken together build upon what I believe is an intersection of the social determinants of health, environmental health disparities, and health equity. As we focus in on local environmental and neighborhood issues as we're pursuing environmental justice, we look to those impacts, again, those cumulative impacts. As you can see here, extreme weather issues we are bombarded by, unsafe water issues, heat islands, energy and housing, and other food insecurity issues, all of that taken together to really impinge upon our health, if you will. Again, let's look at the origins of all of that. Again, we're talking about redlining and systemic racism and underinvestment in those communities. Again, that embarks upon our need and our pursuit of health equity and environmental justice. And that will give us an opportunity when everyone has the opportunity to be as healthy as possible. Next slide, please. I'd like to provide that context in this framework. Again, as we think about the cumulative impacts and all of the stressors that a number of communities are bombarded by. Again, racial residential segregation, urban sprawl, inaccessible resource, dilapidated housing, community design, all of that is taken together with what we see on the bottom of this screen, particularly as we're impacted in thinking about the intersection of all of that taken together. Again, we want to look at the cumulative impacts of a number of things that come together that really impact health and our communities are grappling with today. That actually sets the stage for my next presenter, my co-presenter, Benjamin McKenzie, to talk about this Environmental Justice Index and the utility of it and how it can be important in pursuing environmental justice and, of course, helping us to achieve health equity. With that, I will turn this over to Ben.
Thank you so much, Dr. Buchanan, and good afternoon, everyone. As Dr. Buchanan said, my name is Ben McKenzie. I identify as a white man, and my pronouns are he, him, his. For descriptive purposes, I'm wearing a purple dress shirt and a black jacket, and I have a blue background behind me. Like Dr. Buchanan said, today I'm going to start with an overview of what the EJI is, including some background on environmental justice mapping and screening tools, and then also include information on how the EJI is calculated. I'm then going to take some time to show you all some of the resources that CDC ATSDR makes available to learn more about the EJI. And finally, I'll provide a short demonstration of how to use the EJI Explorer to interact with the EJI data that we make available. So I'll begin with a short description of exactly what the EJI is, kind of echoing that description that Victoria provided earlier. The EJI is the first national place-based tool designed to measure the cumulative impacts of environmental burden on health through the lenses of environmental justice and health equity. That phrase, cumulative impacts, which Dr. Buchanan mentioned multiple times, is a key one. It's something that sets this tool apart from other national level environmental justice tools, and it's a term which I'll discuss in more depth later in this presentation. In short, that term cumulative impacts refers to the multiple environmental, social, and other stressors present at the community level that build on each other and interact to produce patterns of health and well-being. This concept is really intertwined with those social determinants of health that Dr. Buchanan mentioned a moment ago. The EJI assigns a single score to each census tract in the United States that represents these cumulative impacts of environmental burden on health. The EJI builds on existing environmental justice and cumulative impact screening tools and methods, taking a framework developed at the state level and applying it nationally in response to calls from some environmental justice communities, scholars, and others seeking to work towards environmental justice and health equity. Which brings us to the guiding purpose of the EJI, to advance CDC and HHS goals of environmental justice and health equity. We see the EJI contributing to these goals by empowering communities, public health officials, and others to identify areas experiencing adverse health effects associated with environmental burden and injustice, and to focus efforts aimed at addressing injustice and the social determinants of health present in these communities. As I said a moment ago, the EJI builds on existing environmental justice mapping and screening tools that have been developed and refined over the last decade. I want to take a moment to explain a little bit about what these tools are, how they link to the broader environmental justice movement. These tools, which were largely developed at the state level, though there are some national level tools that exist, provide policymakers, researchers, and communities with spatial data on environmental burden and other factors associated with environmental injustice, often with the aim of identifying the most vulnerable, most overburdened communities. These tools, some developed by state agencies, some by academic groups or community organizations, are used to put issues of environmental injustice into context, sometimes helping to prioritize actions like environmental remediation or public health interventions to address those cumulative impacts on health. As you can imagine, with so many tools out there, there's a lot of variation on what these tools measure and how they are intended to be applied. To illustrate this, I'm going to give two examples of environmental justice screening tools that use different methods and have different applications. The US Environmental Protection Agency's EJ Screen is one of the most well-known environmental justice mapping tools. The EJ Screen provides 12 different environmental justice indices as of their most recent update, which actually was yesterday afternoon for those who aren't up to date on that. And these indices are designed to highlight areas of excess risk. These indices are presented alongside many other helpful visualizations that help EPA to prioritize and report on agency environmental justice actions. EPA also encourages others to use EJ Screen for educational programs, grant writing, and community awareness efforts. And because it provides quality, national level, and granular data, EJ Screen is widely used for these purposes and for others. However, the EPA does not use EJ Screen to assess cumulative impacts of multiple environmental and social factors on health. That's not what it was built to do. California's CalEnviroScreen tool is a great example of a state-level tool that does address these cumulative impacts. It's the first of its kind to be officially adopted by a state back in 2013, but certainly not the last, as I will talk about in just a moment. At a high level, CalEnviroScreen brings together 21 indicators representing pollution burden and population characteristics. Taken together, these indicators highlight areas that are socioeconomically disadvantaged due to factors like poverty, linguistic isolation, and unemployment, and are burdened with poor environmental quality from multiple sources of environmental pollution. CalEnviroScreen scores have been used by various state agencies to prioritize that state's environmental protections, as well as compliance efforts, especially in communities facing the greatest burdens and with the fewest resources to change environmental conditions on their own. CalEnviroScreen's method of combining data on pollution burdens and population characteristics to measure cumulative impacts has been popular among many environmental justice advocates and scholars, so much so that states such as Washington, Michigan, Colorado, New Jersey, and others have all recently joined a growing list of states that have passed legislation designed to address environmental injustice and its impacts on health using cumulative impacts tools and a cumulative impacts framework. The US EPA has also recently committed to develop a cumulative impacts framework for that agency's environmental justice activities by 2023, and just over a week ago released a research agenda on cumulative impacts outlining a case for that. Overall, cumulative impacts have become a hot button issue as more and more people in the environmental health field acknowledge the importance of measuring cumulative impacts as a way to promote environmental justice and health equity. Which is why we developed the EJI. After all of this talk about cumulative impacts, I want to spend a minute explaining a bit more about what exactly cumulative impacts are and why we feel it's so important that we measure them, particularly with the goal of advancing environmental justice and health equity. Cumulative impacts are the measure of the total harm to human health of multiple environmental burdens, chronic health conditions, and social stressors, all acting together on health over time. All of these factors build on each other to produce patterns of health and well-being. If you have one neighborhood with high levels of air pollution, but everyone in that neighborhood is in good health and can afford expensive air filters and medical care, and you have another neighborhood with air pollution, water pollution, a poor built environment, and residents with poor health who can't afford that same level of quality healthcare, it's pretty clear which neighborhood is going to be worse off in the long run. So it's critical for us to measure environmental, social, and health factors together in a way that acknowledges and accounts for their interrelatedness and how they act together to drive patterns of health, well-being, and health inequities. This is what we have done with the EJI, where we measure cumulative environmental burden, social vulnerability, and health vulnerability. While it's important to measure cumulative impacts for the reasons I just covered, I want to emphasize some limitations to the EJI and to cumulative impacts mapping tools more broadly. Cumulative impacts mapping and screening tools use a variety of quantitative and semi-quantitative data to provide context and comparison for the chemical and non-chemical stressors, the multiple chemical and non-chemical stressors facing communities. And as such, they are not designed to tell an individual or community whether they are at risk from a particular environmental exposure. I like to show this graph from a paper by some of the leading scholars on cumulative impacts mapping and screening, because I think it does a great job of highlighting how cumulative impacts mapping compares to other tools like health risk assessments that can provide detailed measurements of health risks from exposures. As this graph shows, tools like health risk assessments require a great deal of quantitative data on things like chemical concentrations, community behaviors, and so on, data that simply isn't available at anything approaching a state or national level, very, very granular data. This is why a cumulative impacts mapping approach incorporates semi-quantitative data, things like modeled data on social, environmental, or health factors, or else measures of proximity to polluting land uses, to produce a tool that's valuable for high-level context and comparison, even if it can't specifically be taken as a measure of risk. So now that we've covered why it's important to measure cumulative impacts, and I hope I've convinced some people of that, I'll go into how we measure cumulative impacts with the EJI. The EJI uses data from the Census Bureau, the EPA, the Mine Safety and Health Administration, and the CDC to rank cumulative impacts on communities across the United States. The unit of analysis for calculation and display of the EJI are census tracts, which are subdivisions of counties commonly used to show neighborhoods. There are about 72,000 populated census tracts in the United States, and EJI scores are available for most of these, with notable exceptions in Alaska, Hawaii, and US territories where we don't have sufficient environmental data to draw national level comparisons. Though I will say we are working towards providing what data we can for these areas. The EJI consists again of 3 modules representing the 3 building blocks of cumulative impacts: environmental burden, social vulnerability, and health vulnerability, all of which I'll go into a bit more detail on in a moment, and all of which interact and build on each other to produce patterns of health outcomes and health disparities. These three modules include a total of 36 indicators, each calculated using nationally representative data sets from the agencies I mentioned before, and each measuring a distinct environmental, social, or chronic health factor that contributes to those overall cumulative impacts on health. The EJI uses a percentile ranking method to calculate these scores. This essentially means that census tract scores represent comparisons to all other census tracts within the index along a 0 to 1 scale. So how that's interpreted is that an EJI score of 0.85 for a given census tract would indicate that that census tract is in the 85th percentile for cumulative impacts, or that that tract in question experiences more severe cumulative impacts on health than 85% of all other census tracts in the nation. So you can see what this tool is really designed to do, to offer comparisons and context for issues of environmental justice and health equity, and to identify those communities experiencing the most severe cumulative impacts. These methods are peer-reviewed and tested, as they have been widely used by other tools. These methods are also simple, easy to communicate to a range of users with varying backgrounds. And finally, these methods are easy to adapt to local needs and circumstances. At this point, I'd like to quickly give you all a deeper look into these three EJI modules, and then give an overview of the resources that CDC ATSDR provides to learn more about the EJI, as well as to interact with the EJI data itself. So we'll start with the EJI environmental burden module. The environmental burden module includes 17 indicators, each representing a feature of the environment whose presence or absence contributes to overall environmental burden on health. These indicators are separated into 5 functional groups that we call domains, which represent aspects of air pollution, proximity to potentially hazardous and toxic sites, both positive and negative features of the built environment, proximity to noisy and polluting transportation infrastructure, and water pollution. All of these factors contribute in some way to community health and well-being, and many of them build on each other, amplifying overall effects on health. It's important to note here that the environmental burden module does not capture all environmental issues that a community may face. Data for some important environmental justice issues, such as indoor air pollution or septic system failure and associated soil contamination, those data are not available as national data sets. Other data representing drinking water quality or agricultural pesticide use are also not available in a form that we can use for this kind of spatial tool. We hope to build on this tool as more environmental data become available, but I think it's important to note that when considering cumulative impacts, it can be useful to view local data on EJ issues alongside the EJI. The EJI social vulnerability module, the second module within our index, includes 14 indicators in 4 functional domains, representing aspects of racial and ethnic minority status, socioeconomic status, household characteristics, and housing type. A structure very similar to that of the CDC ATSDR Social Vulnerability Index, for those familiar with that tool. These are all factors that are known to modify or compound the effects of environmental burden on health, and also factors which represent aspects of procedural justice, the ability of communities to influence environmental decision-making. And then finally, we have the third module, the health vulnerability module. This module includes 5 indicators representing prevalence of key chronic conditions associated with environmental justice and health equity: asthma, cancer, high blood pressure, diabetes, and poor mental health. People with these pre-existing conditions are more susceptible to the effects of environmental burden on their health. Environmental factors like air pollution, noise pollution, and aspects of the built environment have been shown to worsen disease in people with these health conditions. So again, as you can imagine, this health vulnerability just compounds those issues of environmental burden and social vulnerability to drive overall cumulative impacts on health at the community level. So now that I've introduced what the EJI is, provided some background on the tool, and given you insight into how the tool was created, this is the part of the presentation where I get to go over some of those resources that we make available to learn more about the EJI, and also to provide a live demo of our tool. The landing page for the EJI can be found here at eji.cdc.gov. Here you can find information on environmental justice and the EJI, as well as a number of helpful informational materials, including a fact sheet, a set of frequently asked questions or FAQs, and detailed technical documentation for those who really want to get into the weeds on theory, methods, and the scientific basis for the EJI. You can also navigate from the EJI landing page to the EJI Explorer, which offers a way to visually interact with EJI data. So let's go ahead and navigate there now. Here at the top, we have our vision for the EJI, measuring cumulative impacts to build towards a cleaner, healthier, and more equitable future for all. We also have links for accessible data options for the vision impaired or others using screen readers, an email address to submit feedback on the EJI, and an option for data download. However, the map is the real star of the tool here, so I want to focus on that. The map provides a high-level overview of which communities are facing the most severe cumulative impacts as calculated by our index. This map offers a number of ways to view and interact with EJI data, starting at a very high level, but allowing users to dig down deeper if they are interested. It all starts with this overall EJI score, which we explain up at the top. Over on the left, you'll see a quick start guide that walks first-time users through ways that they can search and filter to concentrate in on areas of interest. We know that many users will primarily be interested in focusing in on a home county or a specific county of interest. So the first feature shown here is the state and county selector, which I'm going to use now to focus on DeKalb County, Georgia, which is my home county. I can already start to see some patterns here as I'm zooming in. A mix of EJI scores with higher scores representing more severe cumulative impacts in the south and east of the county, and lower scores in the north and west of the county. If I really want to dig down and get information on cumulative impacts and the factors contributing to those impacts near where I live, work, or otherwise spend time, I can also see in the Quick Start Guide that there's a search feature that will take me to a specific address or set of coordinates. So I'm going to go ahead and enter the address for the CDC Chambly campus, which is my place of work. And it's going to take me in to that census tract. It might take a second to load at this level, but I'm going to go ahead and zoom out just a moment. But I can start to get an idea using this tool of all of the different cumulative impacts facing this community. I can use a pop-up box to explore all of the different indicators that are contributing to these cumulative impacts. And I can also navigate from those pop-up boxes to a page on the EJI website that shows all of these different indicators and how each indicator contributes to overall cumulative impacts on health. So on this indicators page, which I can again navigate to from the EJI Explorer as I'm looking at those indicator scores, I can see information on how each indicator is calculated. So for example, with this ozone indicator, I can see exactly what that ozone indicator represents, as well as the year that the data for that indicator were collected. I can also find information on the source of that data, which in this case is the US EPA. And then finally, I can find information in this rationale on how each indicator contributes to the overall cumulative impacts of environmental burden on health. Okay, so going back to the tool, I also want to quickly mention this EJI highlights feature, which is a secondary feature on the map. This feature shows real-world examples of areas with well-known environmental justice issues. These short examples aren't intended to go into a great deal of depth, but rather to point users to the established literature where they can learn more about the environmental justice issues facing these communities. However, EJI highlights also provide a data context for cumulative impacts in these areas. You can see here in this EJI highlight that Flint, Michigan, for example, on average, census tracts in Flint, Michigan experience worse cumulative impacts than 85% of census tracts nationwide on average. Users can also click on these highlights to zoom into these areas and explore the data more deeply. We've developed EJI highlights for Flint, Michigan, Warren County, North Carolina, and the San Joaquin Valley of California, and we're looking into developing more of these highlights for areas with high-profile environmental justice concerns so that we can bring these issues into focus through the application of our data. I also want to make sure to mention that EJI data is accessible through our partners at the National Environmental Public Health Tracking Program, who have incorporated the EJI into their environmental justice dashboard alongside other environmental justice data and visualizations. The EJI is also available on Tracking's Data Explorer application, which allows users to visualize EJI scores side by side with a wealth of other environmental public health data available through the tracking program. I also want to highlight the importance of community engagement in our efforts. Participatory justice through community engagement is a principal tenet of environmental justice. Environmental justice requires that communities are given a place at the table, and that is what we intend to do with this tool. CDC and ATSDR, in partnership with HHS, are committed to engaging with communities, environmental justice advocates, public health partners, and subject matter experts to refine and improve the EJI. We're working with people in CDC and HHS on plans for live demos like this one, webinars like this one, and other opportunities for users and community members to learn more about the EJI and to provide structured feedback that we can use to improve and refine our tool. Again, I want to reiterate that our guiding purpose in developing the EJI has been to advance CDC and HHS goals of environmental justice and health equity. We see the EJI as contributing to these goals by empowering communities, public health officials, and others to identify US communities experiencing the most severe cumulative impacts of environmental injustice on health. By doing this, the EJI can help to focus actions on areas with the greatest need. It can help to shape public health interventions aimed at alleviating health inequities. It can help to guide hypothesis development by those researching issues of environmental justice and health inequity. And finally, it allows policymakers and public health practitioners to establish meaningful goals for advancing health equity and to track progress and evaluate success. I'd like to quickly close out by thanking the EJI team and our collaborators. Again, our collaborators in the National Environmental Public Health Tracking Program the NCH Office of Priority Projects, Innovation and Environmental Justice, and the HHS Office of Environmental Justice, as well as subject matter experts from across the CDC who have contributed their time and energies towards making this tool a reality. And with that, I'd finally like to thank you all for your attention and turn it back over to Victoria for any questions or discussion. Thank you.
Thank you so much, Ben and Dr. Buchanan, for your remarks. So we will have until the end of the webinar at 3 p.m. to discuss these questions. And I've also been gathering these questions, so any ones that we don't answer now, hopefully we can provide an answer to you later. But if you want to ask more questions, please find the Q&A portion at the bottom of your screen. So let's get started. I've had a few questions about how this new tool differs from other tools or builds on other tools or overlaps with other tools. And mostly people have pointed to the climate and economic justice screening tool. So how is this different? How does it overlap? Are there opportunities for collaboration with those other tools? Ben, I'll hand it to you.
I think actually Dr. Buchanan can speak to that at a high level, and then I might be able to answer more specific questions on that issue. Dr. Buchanan?
Thank you so much. I appreciate that. And I was actually about to weigh in and of course, hand it over to you for the technical piece of this, Ben. And so for the questioner, we have definitely been in collaboration and in lockstep with the folks at the Center for Environmental Quality, working on the CJUST tool, which is the Climate Economic Justice tool. Again, we believe that tool is very instrumental, will be very instrumental in moving forward with our Justice 40 initiative and our Justice 40 efforts. And for those of you who don't know what that is a promise by the current administration to ensure that at least 40% of federal investments and benefits are going back to environmental justice communities. Also coupled with that is this very environmental justice index, which we will be using here at the department, here at CDC, as well as across HHS, to really utilize that in some of the work that we're doing, helping to identify, as Ben just laid out, particularly disadvantaged communities. And that term disadvantaged communities is one that has been used by the administration, and it will help us to identify those particular communities. And then also as part of our overall government collective approach, we've also been in discussion with our colleagues at EPA. Again, the EPA EJ Screen is a tool that's been utilized for a while to help to identify some of those communities. And so we are collaborating, and each of these tools are very, very useful tools. In terms of actual uses, there is some nuances in terms of how the tools can be utilized. And I will turn that over to Ben to talk about those nuanced uses, if you will.
Yeah, absolutely. And thank you, Dr. Buchanan. I guess what I would really like to speak to is, again, just to reemphasize that our tool is the first tool that addresses these cumulative impacts on health, that brings all of this to get data together into a single score that addresses that issue. And we also have, a specific kind of theoretical framework that we've developed to support that. And we use slightly different data than those other tools to bring everything together, again, with a different purpose in mind, to measure those cumulative impacts on health. And that's something that we've seen, again, environmental justice scholars and advocates from around the country advocating for many years now. We've seen them specifically look at other tools and say, we want something that measures cumulative impacts on health. And so that's why we've endeavored to measure that with the EJI. So I'll try to stop there at a very high level, not get too into the details on the different measures that we use, but hopefully that answers that question.
And again, as Ben mentioned earlier too, there are a number of states that have state-based tools, and those will be useful as well for those particular states that have them. So I'm just thinking coupled together, and there are lots of utilities for all of these tools, but particularly the cumulative impact and the cumulative nature of the EJI is going to be very, very beneficial, we believe, to communities and others.
Thank you. Thank you both. I have a specific question about tribal communities, and if there's data available on this / a broader question. There are some communities can't be identified as impacted if, all the data isn't available, all of it isn't collected, there isn't access to healthcare. And the question is wondering how you can address this inequality of data in some communities, tribal communities as one example. And is there a way that this index can build off of that or highlight that this is a limitation in the first place?
Yeah, I can start with that one, Dr. Buchanan, if you prefer. So yeah, I definitely acknowledge that we do have lots of areas, or important areas like Alaska, Hawaii, and some low population census tracts across the United States, especially, for which we can't offer scores. And that's a definite limitation, one that we try to highlight in our documentation, in our FAQs. I definitely think that it's going to be important as we go forward to figure out ways that we can provide any data that is available, to at least allow people to view kind of the raw data available, even if they can't contextualize it within those comparisons. That's something that we want to work towards doing, to provide some kind of data justice there. I think it will also be important, aside from just acknowledging those issues. I also really like to point out that we have embedded within our documentation that we encourage people to use other local data, other sources of information whenever possible. This is a high-level screening tool, and it can't possibly speak to all of the different environmental justice issues present in a neighborhood, especially places where you do have those data gaps. So I think it's really helpful in a lot of cases when you're looking at areas for which we don't have data to use local information, local tools, and to acknowledge those issues of data justice in those areas where we don't have data to allow us to measure those within the EJI. Dr. Buchanan, do you have anything to add?
Yeah, I just wanted to say as well that the current tool, we just released it a couple of months ago. So it's still in its infant stages. We believe it has lots of utility, but I want folks to know that we're not just going to stop here. We're going to be working as we move forward to even making the tool better. Of course, it will take time, but we're going to start to dig in, or continue to dig in, and to find and collect as much data as possible where we can make that a little bit more specific and actually capture some of this. Again, we're limited by the data sources and the amount of data that we're able to collect, but we're going to continue to work at this. And this is just the first iteration of the EJI, and we're hoping to make it better and better and better as time goes forward.
Thank you. Thank you both for those answers. I think I'm going to move to a few more questions about the data available, and then we can talk more about applicability and also about how communities can access these tools or training. So there are a few questions about how features of the Environmental Justice Index represent climate burdens or resilience factors. And just wondering if you could talk about those that are available and if there are further plans to include other indicators on that type of topic.
And that would be for you, Ben.
Yes, I was just about to ask. Yeah, so I'll go ahead and say we don't have any specific measures of kind of climate risk embedded within our index. That's something that we looked into early on. It's something that we still have plans to kind of look into as an expansion of our tool. There's still, I think, lots of utility of the EJI for thinking about climate resilience, as we've seen with CalEnviroScreen, which again I think has provided a great model. We've seen that some of those communities that are overburdened by these other environmental issues are also the ones facing facing issues related to climate change. Also, factors like social vulnerability and health vulnerability. Those are really key, important factors to think about when you're thinking about climate resiliency. So I think that there's a lot of interchange between this. It's something that we're definitely looking into expanding, and hopefully we'll have something on that in the near future. Dr. Buchanan, did you have anything to add?
No, I totally agree with that. Again, the tool in itself is definitely something that could be useful. So we think about those communities, as Ben just mentioned, that are grappling with the social stressors, if you will. Those are likely going to be the same communities that are vulnerable to climate change and climate impacts, if you will. We call climate change the effect multiplier. So it will exacerbate the effects that communities are already seeing. And so we will already be able to at least identify some of those communities and to even be sort of proactive about addressing those climate impacts, if you will. Although not resident in terms of data in the tool yet, the tool is still useful in terms of signaling what's going on or what could likely happen in those communities that are impacted by climate change.
Thank you. Speaking of something like climate change, obviously different events are going to proceed to happen more frequently, more often. So just general with these types of underlying data that you do have available right now that you're thinking of incorporating, how often is each indicator or the underlying data updated? And how do you plan to do that in the future?
Yeah, I can speak to that. At the moment, we're still kind of establishing our cadence and rhythm for data updates. We don't have any official kind of a plan for any official kind of rhythm for introducing updates, but we do plan to introduce updates as data from those data sources, new data become available. We want to make sure that we're staying on top of changing patterns. So we will be updating regularly going forward.
Thanks, Ben. Also, so earlier in your presentation, you mentioned local presentations by ATSDR in certain areas. So do you have the process about how a community can go about maybe requesting a presentation or training in such way?
I'll go ahead and take the opportunity to weigh in here and let folks know that we are planning a series of webinars here at CDC ATSR and my office at HHS, the Office of Environmental Justice. We actually have decided on 4 dates moving forward. I can let you guys know that those dates are for now. And Victoria, you can share these in the chat. We are going to host a webinar October 26th, which is a Wednesday, coming up really soon. There will also be another webinar on the 2nd. November 2nd, November 7th will be the 3rd one. And then there will also be one in December. I think that's December 7th. So there are going to be a number of webinars moving forward. Again, for folks to kind of see the demo and how it works, et cetera. Hopefully in the next fiscal year, we're also going to be doing a little bit more hands-on where it's more deeper dive, more of a demo where folks can actually kind of ask questions, more of a training kind of I'm going to say interaction, if you will. We're still in the planning stages for those, but we do know that those 4 webinars are already on the books, and they're not on the website yet, but they should be coming really soon, probably before week's end. So we'll share those dates with you in the chat as well. So you'll know. I'll go ahead and start to put them here, Victoria, and you can share those with folks.
Thank you, Sharonda. I'm going to ask one data question and then one applicability question before we close out. So the last data question that I'll ask is, how can you aggregate or average the data to estimate scores for a group of areas such as counties?
Thank you. Yeah, I'll be happy to take that one. So while it's definitely mathematically possible and relatively easy to do something like aggregating scores from the census tract to the county level. We don't actually encourage people to do that because aggregation introduces unmeasurable error into whatever method you're doing, and it also has the potential to misrepresent neighborhood level of variation in social, environmental, and health conditions. So we encourage people to work with the census tract level data that we have available.
Thank you. And as I mentioned, let's close out the last question with the applicability of the tools. So who did you see as the primary users of the tool? Are we talking about public health officials, scientists, community organizations, and how can they use this tool?
I would say all of the above. Again, and for local health officials that are thinking about interventions and preparing for policy decisions, et cetera, I think this will be a wonderful tool to actually use. We'll be using it within the Department of Health and Human Services, particularly focusing in on those communities and identifying those communities that we can bring a holistic approach to. Again, not only sort of the health interventions, but also human services interventions for this. I think community members can utilize this as well as they're thinking about sort of making the case for issues that they're grappling with in their communities. These communities, in disadvantaged communities, environmental justice communities already know what their issues are. This will to help to solidify and at least allow them to dig a little deeper and have some I'm going to say information that they can hold up to say, hey, X, Y, and Z is going on in my communities. These are the cumulative issues that are affecting our communities. So again, can we measure or do something that will cause us to not to have even more environmental justice issues that are impacting us? So I think it has a utility for researchers, et cetera, in a number of ways, and be creative about how you might be able to use this data. But I think it has great utility, if you will. And Ben, did you have anything to add?
I would just build on that briefly by saying that I think that what I see as one of the big advantages of the EJI is that you can engage with the data at a lot of different levels. Some people, different users will be interested in just that overall cumulative impact score, identifying those most severely impacted communities. Others can dig down into the data to look at what's driving those cumulative impacts, what the issues are that might be facing communities. And then others can download the database, play with the data a little bit more, use some of that data for research, looking into how social and environmental conditions are driving health outcomes in their communities. And we've got all sorts of resources available for those who are interested in doing that. And people with questions are always welcome to reach out to that EJI coordinator mailbox that I had at the end of my presentation there. So thank you.
Thank you.
Thank you both. With that last question and response, that brings us to the end of our webinar. Thank you to our speakers, Ben and Dr. Shrenda Buchanan, for being here today, and thanks everyone for all of your questions. The webinar recording and these slides and the links that were mentioned and further resources will all be available after the webinar. If you registered, you'll receive a direct link, and it will be also posted on our website. And please, if you can, complete the webinar survey that you will be directed to shortly. Thank you all so much for tuning in today. That concludes the webinar.
Thank you.